It's very difficult to be prescriptive about when to seek a diagnosis of dementia. We do know that it's best to do it as early as we can, but one of the things is that many people don't want the diagnosis early on, and in particular, older people themselves who know they have a few problems can often be very resistant to getting a diagnosis.
My mum was just like that. I mean, she did not want a diagnosis, and all the implications that went with that. You know, losing her licence particularly, and her independence. You know, just once that's sort of set in stone, it becomes more real, and the implications of that become more real. So people often put that off.
It's really important not to be brushed off early on, because often people have taken quite some time to get the courage up to see you, and really you have to look at that properly and give it the consideration it deserves.
One thing we were never able to discuss with each other was dementia. He was very sensitive. He didn't want to hear the word. I think he realised that he was not going to talk about it.
As a GP, I've often received phone calls from family members or loved ones who have noticed changes in their either spouse or mother or father, concerned about some changes in behaviour and wondering what they should do about it. And I think that it's really important to get some support and some understanding about what is the patient's rights and what is the carer and the loved one's rights. What I always suggest is, I'm really appreciative that they've given me some background about the patient. However, I can't bring that into the next consultation. It does inform me, but what they should do, if they're at all able, is to bring those concerns up with their loved one, hopefully in a supported environment, and one of the suggestions would be in a general practice room.
I raised it with my mum because I just felt, you know, we'd already experienced these things with my stepfather, and I thought, you know, it's important to start to monitor and ensure that she was a bit conscious of what was going on. And I talked to other people in the family about whether or not they were noticing similar things. But, you know, it's really a watch and see in the early days. I just think, you know, it's important not to place too much emphasis on whether or not this was going to lead to dementia, but just to monitor.
There are 4 common types of dementia, each having a slightly different cause and effect and a different pattern of symptoms. There's Alzheimer's disease, vascular dementia, dementia with Lewy bodies or Lewy body dementia, and frontotemporal dementia. The most common cause of dementia is Alzheimer's disease, and it affects nerve cells in a particular way. Neurons or nerve cells connect to each other at synapses, and the electrical charges release a tiny burst of special chemicals called neurotransmitters, which go across the synapse, carrying signals to other nerve cells. Our brain creates billions of these exchanges, and our experience causes patterns to occur. And scientists think this is how we create and our brains encode thoughts, memories, skills, and indeed our perception of ourselves and who we feel we are. Alzheimer's disease causes nerve cell death and interferes with the way that the electrical charge travels and the activity of these neurotransmitters. The way that people experience Alzheimer's disease varies, but there are common elements. Alzheimer's disease involves a progressive loss of thinking ability and memory, especially for recent events, not recognizing well-known people and places, finding routine tasks harder to do, a vagueness when you talk to them, and a loss of social skills and a sense of reality.
The things that she really loved doing, the friends that she used to catch up with regularly, you know, those appointments started to slip and she didn't turn up, or, you know, she thought it was a different day, or, you know, she just couldn't keep track of some of those things. But that wasn't until, you know, the symptoms had progressed a long way. And, yeah, it was then a case of putting in place strategies to help her, you know, make appointments and continue to do the things that she enjoyed. She certainly started to lose her sense of time and place. It became apparent when we took her to Europe and we'd booked an appointment for her to get her hair done, and it was just downstairs from where we were staying. 5 hours later, after we'd combed the streets of Paris looking for my mother, who hadn't turned up at the hairdresser's.
Another common cause of dementia, in fact 20% of all cases, is vascular dementia. Vascular dementia causes brain impairment by changing the blood supply to the brain. It can be caused by a stroke, the blocking of a blood vessel by a clot, or a stroke caused by a bleed in the brain. But not all strokes cause vascular dementia. It depends on the area of the brain that's damaged and the severity of the stroke. Vascular dementia can also be caused by the narrowing of blood vessels that feed the brain, lessening the amount of blood that can get to a part of brain tissue. The rates of vascular dementia increase with age. People with vascular dementia are more prone to depression and having trouble controlling their emotions. They tend to lose routine and a sense of time, people and place, and can wander purposefully.
He had a stroke, but I notice he'll want to do something and then he'll ask me, has he done it? And I go, yes, well, you have done that. He couldn't talk a lot, but luckily it didn't affect any side of him. It was just from his neck upwards, his speech. He's looking. Roy's always been a ladies' man. He just loves ladies. But now he's completely I call it antisocial. He doesn't. He says, no, I can't do it because I'm embarrassed. I have installed in him, or tried to, if he goes out of our gates at the village, he must let me know, because one time he'd been gone for, I think it was 2.5 hours, and I just didn't know where he was. But he'd had a good time. He'd crossed the main road, and he does sleep a lot now. He's not like the fellow I married, which breaks my heart, but I'll stick by him as long as it takes. So